The topic is really the development of a self-testing instrument for sexually transmitted infections. This is a program of research funded by UKCRC to the tune of about £4 million. And the project is led by St. George's Medical School. And then there are other university partners, that is Brunel is one, Queen Mary is another one, UCL is a third one, and also a small part of the project is also held by Warwick University. And on top of that, HPA is part of it as well. So it's a 5-year program, and we are into about 18 months of it now. So the Brunel part, there are 2 parts of it. One part is to do with microengineering, so I'm going to talk about microengineering. As a colleague of mine, Kate Horn, in Terry's school, she's looking at the HCI side of things in collaboration with UCL. So this is particularly focused on sexually transmitted infection. Now, the program has a number of partners, as you see here. Not all of them are here. There are some industrial partners associated with this program, and their contribution in kind and some equipment and so on is about another 1.7 million. So it's quite a large project, but of course distributed between all the universities that I mentioned about. So we are focusing, as I said, particularly on microengineering side. Now, I'm sure you're all familiar with microfluidics and microengineering for point-of-care diagnostics. There's a lot of effort that is taking place at the moment in time around the globe. And so our focus is, again, really particularly STI. I know there's a company in Ireland, Rendox, has recently announced that they can do multiplex system for about 10 different STI pathogens. Our colleagues in St. George's has identified about 21 different pathogens already on a benchtop system. So our idea is to not to identify all 21, but the most important 5 to 8 sort of pathogens in a system that we will develop. So the work, to do this work, as I'm sure you appreciate, that you need a multidisciplinary team. At the moment, we've got about 17 to 18 people working in the team. This is my team, so they've got multidisciplinary expertise, mechanical engineering, electronic engineering, materials, biochemistry, biology, and so on. So the second row you see there are all postdocs and academics here at Brunel, and then you have all the PhD students at the bottom row here. And without them, of course, we can't do this work. They are working extremely hard to try and find a solution to the problem. Now, those of you who are in this sort of business, you would know that every conference you go to, you will see a slide like this, the rationale for doing this kind of microfluidic related work in terms of why we need these small quantities and fast response, and also the point of need measurements. So these are all standard sort of terminology you will come across from time to time. So just to remind you why we do the work and why microfluidic-based systems are good, that's the reason to show this slide. Now, it's simply not only just microfluidics, but there are other components that comes with it. And one part of that, of course, is the electronics to control the process of moving a biological molecule from one location to another location and so on. So the reason for doing this is, again, there is a real need in detecting STI diseases, particularly the gum clinic clinicians will tell you that the people go there, give their sample, and they don't wait. They disappear, and they don't come back. So they go and then infect further and so on. So there is an enormous exponential growth of this infection in Europe, and from 15 years to 24-year-olds, mainly that bracket sort of age group, it's growing exponentially. So therefore something needs to be done about this. So that's why the UK government, through UKCRC, is trying to fund this work, because you need to build capacity build as well, so that the people can get the training and go and try and sort of come up with these new technologies. Now, the system that we are developing is a sort of integrated system, which has got various components of it. You start with sample pre-processing. One of the things that you probably are aware is that most of the effort has gone on in this DNA detection side of things. And this morning we heard about graphene is a possibility of electrochemical detection. There are a lot of effort that has gone in there. Billions and billions of dollars has been spent on this one. and very little effort is going on in the front end. The sample collection and sample pre-preparation before you actually put it into a cartridge for the detection purposes. Now, another thing, of course, is there are some benchtop equipment that are coming on the market now. What is important is to have a really, truly a handheld device to do this detection at point of need. So not only in the Western world, but also in the developing world, you require systems like this to actually do it on site. So what we are doing is to putting a lot of effort into the front end in terms of sample collection, sample pre-processing, and then, of course, we have to do some sort of processing itself in terms of amplification and, of course, detection. Now, we are taking a generic approach. The next slide will indicate that. There are three major components to this. Of course, the electronic system, which should have not only all the control electronics, but also the wireless communication side of this. It is an important aspect of it because most of the clinical need requires the information to be communicated between clinicians and the healthcare workers. So the wireless communication aspect is quite an important part of it. And then the other two aspects of it is the top part here is where the sample pre-preparation need to be done. And then, of course, then which is some of you are really familiar with this in terms of the cartridge, which does the major processing of the sample effectively in this particular case, molecular diagnostics. So we are interested in DNA. So processing in terms of getting the DNA into the cartridge and then do the analysis and for preparing it for it to detect the pathogens that we are interested in. The trend is being now not only just single pathogen detection, you need to detect multiple pathogens. So there are debates in terms of whether you should use it on a single sort of system or you should use a parallel sort of system to detect multiple pathogens. That debate is going on because there are some restrictions associated with the amplification side of things. And quite a lot of the devices which are existing at the moment as a laboratory research tools uses the PCR amplification into miniaturized PCR amplification because benchtop PCR is well established and is an accepted sort of technology to use. But its recent trend has been to move from PCR to isothermal amplification because you can make it much simpler system. You don't need Peltier heating and cooling arrangements. So we are, in our system, we are using isothermal amplification. So I'm going to skip some of the slides because of the interest of the time. What I can talk to you today is just a work in progress. At the same time, I cannot reveal some of the IP issues that are related to some of the development work that's going on. So I will sort of skirt around it and give you an idea of what we are doing. So the sample collection device, particularly we are at the moment interested in urine samples. For STI, you can either get the pathogens in urine or swabs. So urine is the most convenient form of collecting and then to extract the pathogens from it, and then from that to extract the DNA, and then to characterize the DNA to see what sort of pathogens you've got in the urine. So this is a real challenge, and not a lot of work has gone on with urine, but there have been work with swabs, but urine really a challenge because the amount of pathogens in urine, STI pathogens, is a very small amount. So extracting this is like a needle in a haystack. Most of the people who work in this area will tell you that it is, particularly the microbiologists will tell you that it is really a challenge. What they do on the benchtop is they actually do centrifuging it, pellet it, and then extract the DNA from the pellets. But we can't do that in a micro device. So you need to come up with some engineered sort of devices to do this. So we are working on it, and some of the technology that we are using, we think we can crack this. Sample preparation, and of course you have to do the filtering and then to extract the DNA at the same time as an integrated process. And then once you extract the DNA from this, then you need to go into a disposable cartridge to do all the rest of the processing. The disposable cartridge then will have to go into an instrument where you can control the process of fluid handling as well as all the assays that need to take place in terms of detecting the actual pathogen, particularly the DNA of the pathogen. Just to give you some idea, of one need to come up with some sort of device which can actually take in, say, urine sample, right? Particularly collecting urine from a female is a challenge. So you've got to have to come up with a device which is acceptable to females and also acceptable to the clinical community, that the real sample can be collected. And then you can also look at, in some cases I'm being told by clinicians that these STI pathogens could also be in your saliva. So you need to collect the saliva as well. And of course for swabs is another way of doing it at the moment. Most of the STI pathogens are collected using swabs. So we have now got some sort of devices that we are dealing with at the moment in time. As I said, I cannot talk much about it because there are a lot of IPs attached to this one. But this is an important part of it which has been neglected in the past, and we are actually taking that into consideration. Once you have collected the pathogens, and then it need to be passed through another sort of integrating device which it could actually extract the DNA. Right? Before this project started, we worked on DNA extraction process using superparamagnetic beats. I'll show you some slides very quickly to see what we have achieved. And we did manage to achieve that within about four minutes. Now this is a sort of very simple micro chamber which can hold about 25 microliters of material in it, which can have, particularly it could contain the lysis buffer, containing superparamagnetic beads. They are functional lights, so when the DNA is released from the cell, and then they will attach onto the superparamagnetic beads, and then you can apply magnetic field to hold this DNA which is attached onto the magnetic beads and then flush all the debris. And these are well-known sort of techniques that nowadays utilized by many people, but the challenge is how fast can you do it? And what we managed to demonstrate is you can do it in about 4 minutes from sample input to the DNA extraction. So in order to understand what goes on inside a system that we were using, which really is got a sort of like a sandwich device, as you see here, where the chamber is sandwiched in between the top layer and the bottom layer, onto which we put electromagnets on top of it. And we use that electromagnet to mix it. So it's micro mixing is using switching magnetic field. So we can do that. So in order to understand what goes on, we did some modeling work to find out how the magnetic field changes. And as a result of that, all the understanding is known to us, and so we can manipulate it. Just to give you an indication here, this simply shows that if you release these beads at this end, and it will sort of kind of cover the entire chamber that we are interested in, and therefore you can manipulate them, you can move them up and down and sideways and so on. So this just gives you a quick picture of how we can manipulate these beads, bring them together, take them out in terms of applying the switching magnetic field. Terry just warned me, you've got 5 minutes. So this is sort of gives you an indication that we can actually use blood. We use whole blood in this case. And then use this mixing in terms of trying to collect the DNA that is released, because the actual lysis process is a well-known chemical process, so that's, I'm sure some of you are familiar with it. And when the DNA is released, it collects on the beads, and as a result of that, we can then use a DC magnetic field to collect the beads at one place and wash it through, and then release the beads and resuspend it. And just to show you one sort of simple results because whenever you do these things, you need to compare with the gold standard benchtop standard. The benchtop standard here is a QIAGEN column in terms of extracting the DNA. So we checked against this, and in fact this was done as an independent test at LGC in Terrington. They took our device. They are very familiar with how to extract DNA with QIAGEN kit. And what you see here is these average values that we see here. This is the actual QIAGEN kit results. This is our chip results. Again, for different pathogens, you see it's fairly comparable in terms of extracting the DNA. Now, of course, in practice, if you extract one DNA, then you can amplify it, and you get millions of DNA, which is needed for the detection. Very quickly, this is the I mentioned about isosomal amplification. We've tried to take the normal protocol of the helicase-dependent amplification recipe, and then we modified it to suit for the quantities of reagents that we need and the amount of sample we need. And we tested this at 68 degrees, and we think that this is work in progress, of course. It takes about 12 minutes or so to actually amplify the DNA. And I will not go through this. This just gives you some indication of once you get the DNA, then of course you did the outside, you did the electrophoresis to look at the actual, what's the product we've got. And if you look at the top line here, that's where the actual result is with a benchtop outside mixing, and then on-chip mixing gives you this result. Right. We also are working on the DNA detection technology using magnetic fields. And the basic concept is that if you have a substrate, a permalloy substrate, then you have magnetic coils, tiny magnetic coils. And again, we've done some modeling work, and we've come up with structures like this, interwound coils. You have a primary and a secondary coil. You apply, obviously, almost like a known transformer sort of concept. And from this, if you put them in here, and if you immobilize the probe DNA on a substrate in here, a functionalized medium, and then you bring the target DNA with attached to magnetic beads, when they hybridize, you see a change in the induced field, which will then proportional to the thing. So I won't dwell on this. And again, just to give you an idea that we have the capability to do modeling to find out what sort of physical size we need, where should we place these things, and which gives you a pretty good idea of how do we make the array of sensors to actually detect the known pathogen by immobilizing the different probes to detect different pathogens. Very quickly, okay, just to indicate that it is very necessary these days now to have any of these devices which must have wireless communication technology linked to it. So the concept is that you have a device, and we call this is if you like a device. We call it DOC because when we started the project 10 years ago, we termed the project as Doctor on a Chip. That's why it's called DOC. So that's the sort of a device that we are developing. And then, of course, you have to use the state-of-the-art wireless technology to communicate with the patient and also with the clinician who will actually eventually do the diagnosis. We are very keen that the device does not diagnose it. The information needs to be sent to the clinician to do the diagnosis. So we are also into paper microfluidics because try and, at the end, if you can implement all these technology on paper, which the father of this technology is George Whiteside at Harvard University, and there are other universities are picking this technology up now. We are also interested in developing these. I have a PhD student working in this, so probably in another time we will talk about this. Our vision is that in 5 to 8 years' time, all this development that we're making will have to be integrated with the smartphone. So the smartphone has all the processing power that you need. So once we have perfected the technology ourselves, we will then link it with the smartphone. That means you can design your own ASIC circuits, which has got all the information that you need, and then control it using that. Thank you, Derek.
Thank you very much indeed. Okay, any questions? Okay, yes, question from the front.
I would like to ask, once you extract the DNA, how is there any technique to see how well you have purified so that you can get reproducible results all the time?
Yes, you need to use the standard technique to actually to make sure that the quality of the DNA is right. And what you do is that extracted DNA is then put through the benchtop equipment that's already out there to measure the quality of the DNA.
Okay, so there are commercial equipment.
Oh yes.